day, friends of Fuzzy. Good end of the week if you're actually celebrating weeks right now. So today on our pain management and pain care package broadcast, I'm going to talk about where we started with pain, which is the opioid crisis. I'm going to talk about good news with COVID and the good, the bad, and the ugly, and the nose. I'm going to talk about the ways that you can deal with pain management using the changing of variable mechanical tape. We've talked about this a little before, but I want to go into detail about how to do it. And then also going to talk about video games that are worth trying to have you as a distraction for the focus part of the pain fear focus. All right, so I want us to keep in mind that as the deaths are maintaining their high level, which they probably will, that we also have the crisis of opioid addiction and overdosing, and some of this is not being paid attention to, but the numbers are actually getting worse. The numbers of Narcan doses that were used in March in one community were up 300%, which sounds a lot worse than saying we're 3 times normal, but same thing. They were 3 times normal. A lot of people are now able to get, as a compassionate use, a larger dose of the methadone or the opioids that they were using to deal with their addiction, and now they have those available, and it's more depressing to be in the house, and we're all, I think, getting a little bit tired of this distancing thing, and so more people are taking opioids and overdosing. There's a community actually in Indiana that instructed their emergency medicine providers, the EMTs, the first responders, not to resuscitate opioid overdoses with Narcan because of the risk to the people who are the first responders. At the same time, this is still basically saying that one life is not worth as much as others. And so the number of opioid deaths in the last time we have statistics, which is 2018, was still 45,000 from prescription opioid overdoses. And we are going to surpass that with COVID deaths, but I just want to point out that we still have a health problem that we need to acknowledge is there. And if you know someone who's in recovery, if you are in recovery, there are resources that we'll make available on the site, the Yale resources, but Yale has a list of both for teenage and adolescent people in recovery and also for older adults in recovery, just a list of coping mechanisms and resources. Some of this I bring up because my really good friend and statistician Louise passed away yesterday, and this was related to depression and related to being in recovery, and now she's not in recovery anymore. So we are unquestionably having collateral damage from all of the fear and concern with COVID, and I just want to put that out there to have you reach out to somebody who you may know was in recovery, somebody you may know who's been struggling, and try to be a support for them and check in with them and see how they're doing. All right, I'm going to go to a little good news now on the COVID side. So Gilead Pharmacy is making an antiviral, which was done for Ebola, called remdesivir. And the first study they put out about a week ago was 23 patients, and the stock market got excited, but it was actually stupid because there were still a lot of them that died, and 23 patients is useless. Well, yesterday there was a video chat that was picked up by Stat that was an announcement of someone who has 150 patients on remdesivir. And that one, even though it's still not a controlled trial, it's still good enough for me to get excited because the patients were discharged within a week, and most of the time the duration of hospital stay is about 15 days, so it was much faster, and the patients had their fever go away, which is defervesce is the medical term. So they defervesced quickly. And it really does seem like there's probably a there. So I think that for the patients who get really sick and hospitalized, which is about 15% of patients, we've got an option. And so that actually is very hopeful, because if we get to the place where we're not overwhelming our medical systems, then we can go back to quasi-normal, because the whole issue with distancing is to distance if you're vulnerable, but not to overwhelm the medical system. So if we have something that can keep people who do get sick from getting too sick, that'll help us not overwhelm the medical system, because the duration of stay will be shorter, half as much. All right, so that's one thing that made me happy. The other thing that makes me happy about our outcomes is that the National Health Service in England is now recommending to ear, nose, and throat doctors irrigation with betadine. So basically taking a nasal irrigation tub, squirter, looks like it's got mustard in it or something, but a saline rinse, adding a little bit of betadine, which is an antibacterial, and irrigating twice a day. And so there is a randomized controlled trial of a betadine nasal irrigation going on, but it definitely seems like the trials that are coming out that are looking at how to stop the spread once you've been infected, all of them are, not all, but many of them are looking at nasal sprays and nasal interventions. Another one looked at something with, it's called an EK1 particle, but the basic idea is you've got your SARS-CoV virus that's coming in, and so the spikes are hooking on to the ACE2 inhibitors. But once that happens, it has to fuse with the membrane and the membrane of the cell. And so while it's in this phase, if you were to irrigate it with something, it makes sense that you could flush it off. Also, this fusion, so there's a lot of research that I have been rabbit-holing, squirreling, whichever animal distracting myself metaphor you want to use. But this fusion technique, this fusion is very pH dependent, like acid or base dependent. And so there are some of the coronaviruses that have to fuse at neutral pH. There are others that have to fuse at a slightly acidic pH. But regardless, I think that the possibility of either using an alkaline, so like a base, nasal irrigation, or again, just purely irrigating, this one study with the EK1 fusion blocker protein, they squirted it in mice's nose and none of them got sick. So I think we're going to be able to have an up-the-nose solution, could be a gargle solution, but I think, again, the best thing we've got going for us is this hugely long time between when you get sick and when you get really sick, when you get infected, when you show symptoms, and when you get really sick. And so this really long time, I'm pretty sure it's going to be a nose solution. So there are people looking at that, there are positive results coming out of that, and there's a really strong physical rationale for how the upper airway is put together that makes sense. So I think that will be a thing. Also of note, you probably know that men are more likely to get sick than women, and older people more likely than younger. Turns out first of all, young kids don't have sinuses per se. Like they don't even get their frontal sinus until 6, but the sinuses don't build out until later. So the fact that they're not getting sick and they don't have the sinuses, that could make sense. The adolescents, by then they've got their sinuses, but the older you get, the bigger your nose get, and men in particular. So older men have the biggest nasal cavities of all. So maybe that's why men are getting more sick and older people are more sick. Yeah, there's more to it than that. It's the ACE2 receptor, I know, but anyway, it fits in. All right, so now for focus. So if you are at home and you are dealing with pain, you have to address the fear and you have to address the focus, and you have to address pain itself. So for fear, just knowing that there are going to be, in very short order, mechanisms that we can use to reduce the likelihood of getting seriously sick, and that there are things that if you do get seriously sick, we can treat it. I think both of those are slam dunks, and I bet they're available within the next couple months. So that's good. For a focus, there are two different focus opportunities. One is that there are many museums who have put some of their catalog online. So a virtual museum tour, and even with Google Earth, you can actually find tours of places that you can't visit. So think about a place you've always wanted to go and look at it on Google Earth, and you can actually tour around. So that is a fun, distracting way to decrease your thinking about whatever is hurting. The other focus is that there are a lot of new video games which are interactive, which you can play with multiple people. Now, yeah, you may not have a Switch, and so Animal Crossing may not be an option for you, but we are going to put up a little link to some video games that you may not have tried that may be worth ordering a PlayStation 2. There's probably used ones on eBay that are still around. So we'll put that up. All right, the final thing is, we've been doing this now for a couple weeks, and we've gone over a lot of the different options for what works for pain. So one of the things that in our family we're noticing is that sitting around is really starting to cause us to have backaches in weird ways that we didn't before. And if you have chronic pain, then you know that you probably are sitting and moving in a way that is protecting the area of pain, but it causes pain someplace else. Medically, this is called splinting. So if you're protecting one thing and you strain another, you're splinting. So with our Vibracool pain care packages, we have dynamic tape. And what this mechanical tape is that it's a very stretchy KT tape type thing. So the benefit of this is that you can actually get someone to apply it, and it gives a little bit of potential energy. So as you lean forward, you're getting potential energy, and it springs back with some kinetic energy. So this is the stuff. And if your back is hurting, what you can do is take it and spread it like that. So from one shoulder, there you go, let's draw a person. Okay. A little Kylo Ren in the kind of boxy squareness. But when backs are hurting, you can take this, you can cut it in half to make it a little bit thinner and to have two big pieces of it. But you have the person stretch their back out and stretch the shoulders to the back. And on one scapula, you stretch it. And then if you cut it in half, then you do the same thing to the other. So it does two things. One is when you're slouching, it makes you feel it. And it also gives you a little bit of a spring to be able to put your back into a different position. So this is something that can help get rid of the backaches that we're having from being around the house and in different positions. A lot of times now people are doing their work on computers on their lap, on the couch, in their bed, and this is causing this C shape that is leading to backaches. So a little mechanical tape can be something that can help you remember to either improve your posture, sit someplace else, or maybe not sit in a C shape to begin with. So there is your way to deal with pain today. We'll be back on Monday. Hopefully there'll be some good news between then and now. My greatest fear at this point is that the genie is out of the bottle, the cat is out of the bag, the horse is out of the barn. I think we have too many cases in our population now to stop us from spreading it. And I think that there is a possibility that we as a country will be barred from entering other countries because we haven't been able to control it. The issue with getting herd immunity, which is that enough people have had it to not risk spread, well, if the R naught, which is the infectiousness spreadability of this disease, if it is indeed 2, then we only need a 50% of the population to have had it. It is looking more like it may be dependent on density of population, but it could be as high in some communities as it's been R3 or R4. That would mean we'd need to have a 72 to 80% of the population to have had this to be immune to protect everybody. That's going to take a long time. And I don't think we can let people go out and be mingling until we have the nasal spray, until we have proof that remdesivir works, until we have enough mitigation abilities in place so that when people do get it, they don't get as sick as they're getting now. So that is something we have to start incorporating mentally. The good news on that is that it does seem that the antibodies are working. There's been a lot of different opinions back and forth, but my best read now is I do think people are going to be immune. I think we'll be immune for years at least, and so that means that that'll give us a chance to become immune and let this disease hopefully die out if we can't get a vaccine. So it's a mixed bag. We delayed too much, but we are producing science at an amazing rate, and if we protect each other and if we support each other and if we use this information to direct us to dramatically change our public health system, then at the end of the day, we'll be stronger. It's going to be fine.